Hi, this is Steve from MK Sports Podiatry. Today's letter is G. For G, we're going to talk about gout. Some of you may have heard of gout, some of you may not really know what actually is gout and how it can affect the foot. What gout is a metabolic disorder, and the uric acid in your body then deposits crystals in major joints, typically in the big toe joints, in the foot, but actually any joint of the foot can suffer with gout. It presents as, real angry sort of toe. It's red, it's swollen, it's inflamed. And as podiatrists, we can sometimes see the uric acid crystals actually through the skin. And in worst case scenarios, it can cause an ulcer to split and the crystals can ooze out. But in the sports sort of MSK world, I always keep the gout pathology at the back of my mind. Anyone with that big toe sort of pain, and they're in their 50s, 60s, 70s, and they generally have an unhealthy weight, or they have a lot of alcohol in their diet, rich foods, fizzy drinks, not very much vitamin C. Loads of these things can build up, and you can present these symptoms. To go about helping is to combat them, doing an exercise, looking at your diet. Also, because that area is inflamed, we quite often deal with getting orthoses or offloading an insole to help shift the weight and the pressure away from those painful areas, especially if it's a real occurrence. Also, if weight management and the healthy diet doesn't help with gout, you can also see the GP, where they can put you on medication, something like allopurinol, to help regulate the uric acid crystals. So it's not as common we see in the sporting population, but it is always still there and it is always still relevant. It affects men more than women, and the old back in the day Henry VIII. Okay, so today's letter is G. So check out everyone at the CF Foot Clinic as well, who are doing their own A to Z. We may have a crossover with this one, with gout. They might use gout for G as well, so we'll have to watch this space. Okay, right, see you later guys.